Hey, everybody. My name is Jeff Pope, the practice leader of the Senior Living Solutions team here at True North Companies and Benefits Advisor and Workforce Solutions practice leader. And today I have with me Kyle Ray. Kyle, you want to take a second to introduce yourself?
Absolutely. Yeah, I'm Kyle Ray, the self-funded practice leader at True North Companies. My background is actually finance and accounting, and trying to find as intricate and innovative ways as possible to be able to do alternative risk financing. Glad to be on here.
Yeah, thanks, Kyle. When Kyle and I were talking, we thought about putting something together. A lot of folks just finished up their open enrollment renewal season. Some folks have mid-year renewals coming up. So a topic I think that's on a lot of folks' mind that we've been working with in the senior living space. And then COVID's also exasperated, I think, Kyle. We've seen some other issues, from cost to workforce issues and just a whole myriad of things. So we thought we'd take a moment today because kind of what we're hearing in from the industry and in the space here is, senior living are not just our clients, but organizations that we speak to, folks that we work with and are talking to are really getting tired of really just the complexity, the rising costs of healthcare, the lack of transparency, and then just, really feeling like no matter what they do, they just might not have control, over their benefits program. And as we delve deeper into that, especially in the senior living space where there's so much complexity, we thought we'd really just, make it simple in our view on how to help organizations not only gain better control and transparency over their benefits, but really tie that into how, it helps your workforce. So Kyle and I just want to take a few minutes today. We've created a very simple 4-step process that's helped a lot of our clients reduce their spend upwards of 30% on their health insurance. And, it's really just a simple process of, every day, when you go to purchase something, right, there's just a logical flow into how you do that. But there seems to be this complexity that, we see around, the benefits programs and, how do I control that cost? I think people also have a misconception of, what's the difference between loss control and wellness, and how do I get transparency, and how do I just, reduce our overall spend and then, get this out to the workforce. So just wanted to take a few minutes today and speak about the 4-step process we created that we work with our senior living clients on and have had a lot of success. So Kyle, do you want to maybe, take a couple minutes and just take us through, what some of those steps look like and, how they benefit our clients?
Yeah, absolutely, Jeff. I want to just give all 4 steps overview very quickly, and then we'll talk about one a little bit more in detail and go through them. But essentially, the need for this stemmed from the fact that the whole industry of healthcare is so complex and it's designed that way. And it makes a lot of our employers, they had to be reactive and try to do the best they could with whatever product they could find. So instead of finding a product for our clients, we developed a process, and it's more of a service-based solution. So when we look at this with our clients or prospects, we look at it in these 4 steps, which is, first of all, identify right fit providers. Not all the providers are the same. So essentially choosing the network, and that's now your chassis that you're going to run on and make the most out of it. 2, create a fair and transparent payment structure, because without that, you'll never have consumerism. 3, proactively manage utilization. It's not just about the renewal, it's about what's happening between the renewals that drives down cost. And then 4, you really need to have the right structure and support system in place to get the most out of it. And that's where we use our workforce optimization platform with our clients.
Yeah. So those are the 4 steps, right? So just to kind of, read back to what Kyle said here. First, we need to identify the right fit providers, and maybe we can just unpack each one of those, Kyle, for everybody real quick. I think with me, what I see a lot when I'm having conversations with folks in the senior living space is, they might have a major market carrier in that space, and that's the first thing they don't go to because they have a good brand name. They have a good reputation, and they think, well, I'm self-funded with that client, so I'm doing all that I can to reduce my spend versus being fully insured and take control. But I think what you and I both know is I think a lot of people aren't pulling enough of those levers to really gain control and transparency. And I also think there's just a lack of education out there in general, of folks of what really self-funding is, how you can gain control over your plan, how you can create a transparent model, and how you can also be in control of almost creating your own network, or like you said, create a chassis for yourself, right? That you can then surround and build off of from there. So I think some of it comes down to the education. Maybe Kyle, if you want to just take a second and maybe share with some of your experiences with some of the clients that we work with, and how we've maybe just given them a little better chassis to work with than maybe they knew existed.
Yeah, absolutely. So the first one of the largest misnomers is that the wider the network, the more quality the network is. That's not the case at all. It used to be that preferred provider organizations used preferred providers based on the quality and also a cost factor. These PPOs have gotten larger and larger and larger to where now it's about trying to have as many providers in the network as possible. Well, as we know, it's already complex enough. We don't need our employees, our members, to have to try to figure out what is actually the most quality, what's the right cost. It's too much. So if we actually can educate and work with our clients, work with our employees to say, well, let's find the best quality at the lowest cost. It may not be the widest network, but it will be enough network based on your demographics, based on your needs. But what there also is there's almost this inverse correlation that happens. When you don't have as wide of a network, you actually typically have more control. So when you have more control, now I have more levers that I can pull in order to get more consumerism, to get more cost containment features in. And so we always start with that step one, because it really comes down to what are we going to do to design the right network, because that'll allow us to understand what chassis now are we going to build off of from there on.
Yeah. And that kind of leads to number two, right? Create a fair and transparent payment structure that allows consumerism to really drive that pricing, as you mentioned. And that's really what helps our clients gain control, and reduce their spend. And, you mentioned network, Kyle. I think to your point, I think, of course, we want a quality network. Extremely important for all the employees, especially for the management companies that we work with. They have locations that are not just in one state, it's multiple states, or sometimes all throughout, the country. So the network is very important. So we'd obviously structure that for them to have that network. But, I think there's a misconception out there too, that by having certain networks or being with those large, wide network carriers, we'll call them, that they're getting a discount by being part of that PPO provider network, right? Well, and I think a lot of folks in the senior living space will understand that, right? What that discount really is, that's a discount based on the Medicare rate, but it's driven up 150, 200% sometimes. So what are we really getting a discount on, right? So where are there areas that we can take advantage of a more transparent, fair pricing type model while still being self-funded and offer a very wide network, obviously that fits the scope of your workforce, and they don't lose anything from that perspective. But how can we really take advantage of that to drive down costs for our clients? And I think that's just an area that maybe hasn't been explored in the marketplace a whole lot.
Absolutely. There's so much analysis that should be provided to employers to help them understand based on the needs of their workforce, based on where people are going to get services, based on how those providers price. Are they pricing with a humongous spread? Do people need a national network? Depending on a lot of factors, it may turn out that a wider network with more of a discount methodology may be important.
Mhm.
But it could be that it could be very easy that if we didn't run that network, where we could go to a more simple reimbursement methodology with providers, and in some cases may be as much as reference-based pricing. where we're using a solid number that the hospitals and the government have worked out, and we are paying a little bit more than that just to be able to create a little bit more of a margin for these providers. And typically that will end up resulting in direct contracts with our favorite providers that we're working with. So again, it really just comes down to, if we know the network, whether it's a wide network or whether it's no network, creating that fair and transparent payment structure, it essentially allows us to go in there and say, well, even if we do have a PPO in place, can I audit to make sure that these auto adjudicated bills that are coming through, to make sure that they were actually paid with the right coding, the right ICD-10s. We want to make sure that that's happening because it's the employer's money. So regardless what network, we always want to make sure that there is a fair and a transparent payment structure. Typically, you have to fight back pretty hard when you have PPOs in place, these wide networks, to be able to get that kind of control. But it's essential to do the best you can with that.
Yeah, absolutely. I totally agree. And I think we've even heard from our clients, they're still not sure how the whole COVID picture, just from their whole organizational standpoint, is really going to map out. And so cost is going to be important. But I think the one thing that, we both know and that we're seeing is, costs certainly, from your health plan perspective, aren't going to go down, right? Like they're going to go up every year. There's going to be that trend. It's going to be there, right? So, we're really just trying to put our clients in a position to, put themselves in a transparent model that allows them to take control over their plan versus being dictated what those discounts are. And that kind of brings us to number 3, right? There's another component that I think is a big misconception out there: proactively managing utilization and cost containment strategies, right? I think the first time we start talking about cost containment strategies or loss control, the first thing we typically hear, right, is wellness. Now, we're big proponents of wellness. There's a place for wellness, but I think they're 2 separate buckets. And I think they really get lumped into just the loss control strategy, right? So really the way that we view this is, you got the wellness, which is more of a cultural aspect, really kind of hard to calculate that ROI. We do know that there is a very positive effect from a cost reduction standpoint, because maybe we do catch something that doesn't turn into a large claim. And as we all know, the best claim that's out there is the one that never happens, right? So there is a piece of truth to that there is a loss control strategy. But I think the way we view at True North and our senior living practice, cost control is really making sure we're driving down, utilization, making sure we're proactively managing areas. You mentioned one area of focus, Kyle, in direct contracts, right? Like, what can we do throughout the year that we're proactively helping manage that, program to really reduce down that spend? And I think in the senior living space, we see this a lot on the risk management side, where people have real tight cost control measures, but for some reason, it doesn't seem to translate with a lot of folks, even outside the industry, of really having those same types of loss control measures for health insurance. Because although we might not be able to prevent cancer or a heart attack or some of those types of claims, there are a lot of things that we can work towards preventing. There are a lot of areas that we can redirect care. There's a lot of things we can do. So Kyle, maybe if you want to take a second and just talk about, expand a little bit on that and what we're doing with some of our clients, because I do think they're 2 very different things, and again, seem to get lumped into one.
They are, absolutely. So, yeah, and you described it very well with the wellness side. I am absolutely for wellness, but the hard part is that for a while there, it seemed that most of our employers, they wanted to understand the return on investment for that.
Right.
And I would always frame it up to them that it's one of those things that is more of a culture that you're trying to establish. It could be compared, I believe, probably best to good leadership in a company. So good leadership, you really can't point to a return on investment or a KPI on an income statement, but what you know is it makes a difference and it's important. So if a company wants to set a wellness culture, then it makes sense to have a wellness program in place. But there's some companies that may have higher turnover, or just because of the nature of their business, that's not the most efficient use of their dollar. And that's okay. There's not a problem with that. There's nothing wrong with that at all. But that is a completely different strategy than what I would consider to be other cost containment features. Again, if we look at the steps we've already laid out, if I have the right network based on the absolute needs of my workforce and where they're going, and then I have an actual fair and transparent pricing schedule or payment structure, now I start to look at the data and I start to look at where my claims are happening. And I never want my employers to confuse the fact cost containment is not cost shifting. It's not taking away benefits from the employees. It's
Absolutely.
finding the best way to utilize the great benefits that are in place. So we look at it from how do we get the point of service to be the most correct for maybe what a person's going through. For instance, trying to educate maybe around misuse of the ER. Don't use the ER for something that you could have used a virtual health visit for, or you could have possibly waited and went to urgent care. You know, what things should you go to the ER for? We want them to know what those things are. If your child slips and hits their head, please go to the ER. Don't wait to go to the emergency room. I mean, the urgent care. So we try to educate so that we get the best outcomes. That's one way. The other way is to put other things in place that I believe actually enhance the benefit, but also concurrently reduces cost. One example would be almost 30% of cancers are misdiagnosed. Now, that's a cost issue, but it's also a culture. It's also a humanity issue, if you will,
For
because
sure.
someone's not getting the best treatment. And their hair's blown back when they get diagnosed. They don't know what they don't know. And so, one of the things that we like to put in place is maybe a second opinion virtual visit. As soon as they get diagnosed, before they get ushered down the hall to start treatment right away, we try to put a timeout in there and say, let's get that recommended course of treatment, get a second opinion from the Centers of Excellence, and let's try to make sure that whatever we're about to not only pay for, but what you're about to go through is the most correct thing based on your actual diagnosis. That's how we try to influence not only the cost decrease, but also quality of the benefit. There are many different ways to use additive type of programs. Another example, just one more example, I'd be glad to give would be we oftentimes see that point of service or point of place of service where someone's receiving a really expensive, maybe $100,000 infusion of something like Tecfidera in an outpatient setting.
Yeah.
Well, the employee has to go before work, or they have to go after work, or maybe they're having to take time off of work to go and sit in an outpatient setting where there's other diseases in there as well. And we know that not only is that drug marked up considerably, but there's also the fact that the hospital is getting the rebate and not the employer-sponsored health plan. So we look for those opportunities to say, well, what happens if we have someone purchase that underneath our pharmacy benefit? We get the rebate, and we also get it much cheaper, and we're able to set it up where that employee can receive that same great quality treatment in the convenience of their home. That way they can do it after work, before work, but it's in the convenience of their home. And we've had tremendous success with those things. But again, Jeff, that's just the way that between renewals, 80% of your cost in self-funding is your claims. So that's where we should be concentrating most of our efforts.
Yeah, I absolutely agree. And, I just kind of go back again to talking about, the risk management side and the clinical perspective too. And I think one thing that we've really done different that also meshes really well within, this industry is provide, that clinical side, that clinical knowledge to looking at claims and not just, redirecting a claim or reacting to a claim, but identifying areas that we can help proactively manage outside of case management, right? And although I'm a big advocate of case management, I think that's actually the key word. Sometimes those employees need an advocate, to really work with, parallel to, that case management program through that TPA or carrier. And then I think also just having that clinical person on our team also, relates to this industry really well. So those employees have a much greater comfort level, when we're providing that clinical aspect to it as well. But I think the last thing we want to do is just be reading out to our clients what claims they've already paid. To your point, 80% of their spend is on their claims. It's what are we doing consistently, right? That keeps our eye on the ball for the client to help them really gain control over that plan and reduce spend. So I think that's a very good point, and I think setting up the right chassis and the right model is super important. But is what do you do with it from there? So to me, this is actually the most critical step that I feel like is missed a lot, and I'm sure you agree with that, Kyle. And then step 4, right? So why are we providing benefits in the first place? We know that this industry, workforce issues, turnover is a big issue, right? So how do we solve for that? It's not just by having, the least expensive benefits, but if we could also create, like we have with many of our clients, a structure like this that saves them 30%, up to 30% on their spend. Imagine what our clients can do with those dollars by reinvesting them back into their workforce, right? So we have clients that are able to then, reinvest those dollars in their workforce, reduce their turnover, and let's face it, that's a large cost in and of itself, right? So it's time, it's money, it's your brand that's at stake, right? So it's super crucial, not just to have good benefits programs that are affordable, but also to your overall workforce, right? So step 4 is really workforce optimization and the utilization of our platform, right? So that's how can we communicate and educate your employees on, the great benefits that are available. How can we help you be an extension of your HR team to build your brand, right? How can we have our HR professionals? So we've recognized in this industry and in this space that workforce is the number one issue, right? So it's not just about the financing and the loss control. It's how can we tie it all together then? So we've built this workforce optimization platform out to really tie all of that together. How can we create administrative efficiencies because there is a lot of turnover? There's multiple locations, right? So big picture wise, really step 4, with our workforce optimization platform really just kind of rounds out this simple 4-step process. So Kyle, I don't know if you have anything to add on that piece, but super critical because the whole reason we're doing this in the first place, right, is for that workforce. Benefits is an expensive, one of the top expenses on these organizations' line items, right? But it's also, besides a paycheck, the number 1 or 2 way to attract and retain top talent. And we definitely know that this is an industry wrought with competition for talent right now. So super important to create a competitive advantage and do everything we can to support our client's brand.
Yeah, it's so interesting. This is what makes it happen, right? Because our clients in the senior living space, they're usually not only experts in what they were hired to be, but they're also having to run around and put out fires as they arise in all kinds of areas. Even though they're some of the most intelligent people that we get to work with, the problem is that they have too much on their plate. So we can tell them all day, help them understand the networks and understand transparent pricing. We can help them set up a really good cost containment program. But at the end of the day, they don't have the luxury of time. They don't have the ability to administer a lot of things. So what we do, and where I think we are uniquely different, is not only did we recognize that they needed those first 3 steps, but we put together experts in 6 major areas of focus that allows us to get this done. The key is that these experts are not sitting in different offices across the country, leading a division of other experts like that. They are sitting in the same room for our client, and they're harmonizing loss control with education. They're harmonizing education or communication strategies with technology. So we have employee advocacy harmonized with other team members. So it allows us to get this really innovative, sometimes complex platform and do all the heavy lifting for our clients. And all they have to do is meet with us quarterly and they can see the output of it. We can get right to the heart of what they need to bring up, what we want to talk about. But that's it. They can be assured that it's getting done. And to me, that's what makes all of this work. And that's what has allowed us to make a difference in the senior living space.
Yeah, absolutely. And, I hope this was worth everybody's time. We just thought it was an important topic because I think, um, you know, COVID's really exacerbated a lot of problems that our clients are already, were existing challenges to them in the first place. And now they've just become that much more exasperated, right? And, um, we need to find innovative ways to help our clients, not just reduce their spend, but, you know, really optimize their workforce, right? Because that's what they're providing the benefits for in the first place, because those people are going to be the ones that determine how well that organization does, right? And allows them to grow. So we hope this was helpful. Look out for more information from Kyle and I on this unique four-step process. Again, to really simplify and harmonize what can be really kind of a complex subject and topic in employee benefits. So, Kyle, really appreciate the conversation today, and look out for more videos from us. And again, we'll be reaching out real soon. Take
Talk
care.
soon. Leave on you just